It means more people can get their hands on that drug cocktail.
But health experts want to remind people this treatment does not replace getting vaccinated. Today, Jacina Coronel spoke to staff running a monoclonal antibody clinic. She joins us in the studio to tell us more about this, Jacina.
Yeah, Kelly, so I spoke to one of the nursing leaders running a clinic at St. Joseph's Hospital. Now, she's been taking care of COVID patients from the very beginning, except now she's excited to give patients this tool and some hope as they fight to get better.
We have people that drive an hour, sometimes 2 hours to get here.
At SSM Health St. Joseph's COVID-19 infusion center, staff are trying to steer patients into recovery.
It doesn't prevent you from getting COVID, it prevents the COVID from getting worse.
Monoclonal antibody therapy works on high-risk patients who have the virus.
It's within the first 10 days of the onset of symptoms, so it's very critical that they come in a timely fashion.
But what does the drug cocktail entail?
The infusion itself, the medication, is a synthetic protein that mimics our antibodies in our body. So it's just filling you up with a bunch of antibodies to help fight the disease.
It attacks the virus and prevents the virus from replicating, so your symptoms aren't as bad.
This little bottle goes into an IV bag, and the one-time infusion takes about 20 minutes.
And then they have to wait for an hour to make sure, since it's a new drug, new treatment, they have to make sure they don't have any adverse reactions to it. So we have to watch them for an hour, and then after an hour, they head home.
The treatment can be impactful.
We have heard back from people every once in a while. They'll call and let us know that they're a week later and they're feeling great.
And not just for the patient. The head of the St. Louis Pandemic Task Force says with every 10 infusions, we avoid a hospitalization.
When they're not here, that's leaving our beds open and leaving the staff open to care for all the other illnesses in the community that, of course, still exist.
St. Joseph's Director of Pharmacy, John Buchanan, says this therapy is a viable option. Yet this isn't a substitute for the vaccine.
Number one choice, I would say, is vaccine. Vaccine, vaccine, vaccine.
His goal is to drive home this message about the monoclonal antibody and the vaccine.
It works, it's effective, it's safe.
Just to give you an idea of this treatment's impact, through a clinical trial, this therapy showed it reduced the risk of hospitalization or death by up to 70%. But like health officials have said, the vaccine is the best option that could prevent the disease altogether.